minutes. Okay.
Good morning. Today is Tuesday, September 2nd, and present with us is Pam Hanna with the Health Department. And with that being said, we'll get right into the meeting. I have minutes here with the county health nurse of July 8th, 2025. I just need an approval.
I motion that we approve those minutes, Mr. Chairman.
Okay, and I second. All those in favor?
Aye.
Aye. Okay, motion approved. Getting right along. Pam, we'll just jump right into it. Would you like to start us off, please?
Well, I usually start us off telling you a little bit about what we've been doing with disease investigation. And so we are seeing an increase in COVID cases the last month. And the state is also seeing a similar increase. We've had 2 or 3 in the past couple of weeks, but over this past week, we had 5 new cases. So a little bit of a concentration of COVID. It's in all parts of the county, mostly our middle age range of folks in their 40s through 70s. So we're kind of watching that. We did have also a couple cases related to a long-term care facility, but those people lived outside of our jurisdiction, so they weren't our cases, but they worked in one of our facilities. It didn't affect the facility in a way that we needed to make it an outbreak, but we are seeing that. We also are heading into respiratory season, so we're starting to prepare for vaccinations, flu vaccinations and COVID vaccines, but there's still a lot of unknown from the federal level about what's going to happen with COVID vaccine. I'll be on a call with our state partners this afternoon, and hopefully that'll help us clear up some of that. But our flu vaccine is coming in. We've also had a couple gastrointestinal cases that we've investigated, you know, same kind of thing. People are out and about eating other food in the water, those sorts of things. So those have been other investigations we've had. And we have had throughout the summer 3 cases of chlamydia. So that's been a little bit more than what we see in that condensed amount of time. So those are some of the things we've been really working on.
Can I ask you something since you're talking COVID? Mike, I guess I'd ask this time of year, how is it that they know that it's COVID as opposed to this stuff like somebody, you know, intestinal problems or that? How is it that they're relating it to that as opposed to say like asthmatic or not asthmatic, but allergies or anything else? How is it that they know that it's COVID?
So they're testing. So we're only getting notified of the positive tests for people that test. So it used to be we were notified of every home test that was done, and that's no longer happening. So these people have gotten tested in a medical facility, and then COVID-19 is a reportable condition through state law. So when a medical facility or a laboratory discovers that somebody has that, then they report it back to the county where that person lives. So those are being reported to us through mostly through the state's MIDAS program, which is the Montana Infectious Disease system. And so that's how they come to us. Sometimes we'll get a call from somebody, but we always want that documentation that that's truly what we have. So the other interesting thing that we've had, which is summer related to our animal bites. So we have, and this is atypical, is we actually have 2 people that we're treating right now in the county for post-exposure prophylaxis for rabies. So one of them is a person that was bitten by an animal that had a pretty severe bite, and this animal was livestock. So there's not really a standard for watching that animal like there is for a bat or a skunk or a cat or a dog. So they were treated at the Veterans Hospital, and their provider recommended that they have this. So we're helping provide those vaccinations by getting the vaccine from the VA and doing a home visit with the person that lives here. And then, we have a child that traveled outside of the state with his family who, touched a bat, and it was determined the bat was rabid.
Hmm.
So the state park sent that animal in for testing because it was acting peculiar. And so then we were notified that little guy had an exposure. So that little one's also getting vaccines to prevent rabies, because that one is probably a more possible case that there would be an exposure that would be harmful.
So
So
you're saying that bat was alive at that time?
it barely, yeah, and the
But it
little
was.
guy was poking it to see if it was okay, and so
Okay.
because there was contact with it and because the bat came back testing positive for rabies, then it was recommended that this person have
Okay.
post-exposure prophylaxis. So that's kind of atypical too. I don't remember, only a couple of times we've had to provide that for people, and we've got 2 this week, so. Anyway, so I know, so when it rains, it pours. So that's kind of what we've been doing in that realm. We've done a lot of events over the summer, including Clancy Days, Frontier Days, and the fair, which is the one we just finished. We've had a lot of engagement with the public through a raffle that we talked about the services we provide. We were able to give out prizes to people for that raffle, and that was kind of fun, and everybody appreciated that. We've also been participating in the farmers market here on Thursdays once a month, also doing the same thing, just kind of talking to people about what services the health department provides, having them meet our staff, sign up for things. One thing that we're doing in September is Aaron is trained to teach QPR, question, persuade, refer for suicide prevention in September, Suicide Prevention Month. So I'm going to leave this with you guys. We have each of the libraries, Boulder, Whitehall, and Clancy, is providing space for this to be taught during September. So last week of September. So if county employees are interested or others are interested, those are a great opportunity. We're also willing to teach to the county employees if that's something you would like to have done. So that's another thing that we're doing. Molly has been in a couple of the schools doing CPR trainings for their staff members. So every couple of years they have us come in and recertify for CPR. So that's another nice service that we've been able to provide. And then we're really, like I said, gearing up for respiratory season. Everybody's had vacations, so we've all been kind of filling in spaces, while people have been gone. I think Aaron and Tana are gone a couple times the first part of the month, and then hopefully I'll have a full staff again for a while. And I did talk with Kim Frankie. She's helped us with immunizations during our heavy season to see if she wants to come in and do some temp vaccination for us, and she's agreed to that. So I do have some funding with immunization money that Ginger's put away to pay her for that. I will be gone this Wednesday and Thursday to White Sulphur because there's an in-person Pathways to Accreditation meeting that I'll be going to. So that's that one new grant. So kind of getting us off the bat there. And then I'm going the following week to Havre for the near-term initiative kickoff meeting. We're going to meet in Havre, but we're going to go up to Rocky Boy to see what they've been doing with a youth facility that they have up there. They'll be filming us with Dead Dinosaur Productions to talk about what we're wanting to do with this funding. And we do have our ad out for the behavioral health coordinator. We've had one application so far. Kelly's out of town now, so I don't know if there have been more, but one came in before she left. So we're hoping to get someone hired and get them going hopefully by the 1st of October if possible. So we can get moving on some things. We've got State of Mind coming in October 8th and 9th. So that theatrical production that they work with the high school and the community to do, and the actual evening performance will be at 6:30 at the Clancy Community Center on the 8th. So that'll be kind of nice. They're just starting to inaugurate that building. And then we'll have a coffee and conversation here. And Kayla said that we can use the Elkhorn as long as it's not sold. So we'll probably be there. And so with my traveling, we've got the Forester. So I was hoping it was okay with you that I take the Forester to White Sulphur, so that I could take it on a road trip and kind of see. Jesse and I took it to Sheridan when we went to McFep last week, and Tana took it to Whitehall one day. We're just kind of trying to drive it and see what's going on. Tana is taking our Outback in to have the oil change today, so I would like to leave before she gets back. So if you're okay, I'll take the Forester to White Sulphur and kind of give it a run and see where we're at.
Use it
with
as
it.
much as you can, absolutely.
And then if it's okay, the following week when I go to Haber, I'd like to take it then to leave the county car for my staff, because we've got Whitehall Clinic on Tuesday. And then the last thing that I have on my list is this certified letter that I got. I shared an email with those mentioned in the letter just to provide information. I haven't responded back to this person, but because it's addressed to me, I would like to do that. And so I didn't know if you had any input on that. I know we've all kind of talked through email about this situation, so.
Yeah, I think however you want to reply, he actually wrote me a letter too, and he singled out some kind of a chemical that, I don't know where he figured out this is in there. I don't know where, even if it is in there, but he wanted me to look at that chemical and figure out what it is. And without me even know it's in there, I have no idea how to reply to him, so.
Well, and I, if you remember Jim's response to that email chain said that they did look at that chemical and that they saw no harmful effects through that. So I think I'll just mention those things and.
Yeah.
And I know
And yeah,
poor Matt say this is an environmental health issue for the most part, so.
and it should be a moot point now that it's chip sealed. There should be no more dust until.
So it sounds like there were several letters that were sent.
Me and you were the only ones out here.
Okay.
I don't think
I did not.
anybody else did.
So when I asked Molly about it, because he mentions in here that he had talked to our department before, she said that she had gotten a call from someone asking who was, how do you put it, who was in charge of public health. And she said, well, that kind of depends on if you're talking about, and she tried to explain the difference between the nursing side and environmental health. But she ended up giving this person my name, because he was pretty vague. So I think that's why I got the letter. But
DEQ could have got one too, being he's trying to get all the environmental side of it.
yeah, well, I don't really know a lot about the situation other than what I've heard when I've come into this meeting. All right, well, I'll respond to that. And that's really all I have on my end.
Okay.
Will this be in the newspaper? for folks?
It's in the newspaper. We did change the Clancy date because we didn't have anybody sign up until this weekend, and so it was one person. So I asked Erin if she would be willing to change. I didn't want to not provide it for the person, but to see if we could maybe get a few more people. And the Clancy Library was happy to switch it to
What
that.
date have you got,
What's
Yeah,
that?
What date have you got then for library? Was it what, right?
So those are the right
Oh, this is
dates.
the right-
Those are
okay.
yeah, we corrected
I'll
the
I'll
handout,
announce it
so.
today.
And those were the dates for Whitehall and Boulder originally. The Clancy one was supposed to be tonight.
Oh, okay.
So we've moved it back, hoping to get somebody else. And the person that wanted to do it tonight can come on that day, so.
The other thing I want to ask, because I don't know, who's Crystal? Is she one of your
Crystal
employees?
Kishbaugh, she is a nurse, psychiatric nurse practitioner that works here in the county. She,
Oh, her.
yeah, she's
when-
on the mental health
Oh,
LLC.
yeah,
She works
okay.
at the high school. She
I
has
gotcha.
a practice out in Montana City.
Forgot her name.
She's
Thank you.
Mark Kishba's wife.
Okay.
So
Yeah, I remember
she's
meeting
also
her.
trained to do QPR, so,
Oh.
and you can see the mental health LAC logos on there too, so.
Mhm. Cause the reason I see this Lewis Park Suicide Prevention Coalition, I've gone through that class with them, Dad and Michael. One time, the two gals that put it on, that's for what to look for in mental health and stuff.
Mhm.
So I didn't know if this all tied in together.
Yeah.
That's why I was asking.
Yeah, they do a good class. I mean, we've worked with Lewis and Clark Suicide Prevention Team. And one of the things that they offered us through that MOU with them is to do trainings. And I said, well, actually, I'd like to have funding to train trainers so that we can sustain this here. So that's why Crystal and Aaron
Oh,
can do this, is that Lewis and Clark Suicide Prevention
Right.
Grant paid for them to be
Oh, okay.
trainers. So now we can train here.
same class. then.
Yeah.
Okay.
So. So that's what we're doing. Health department wise.
Been busy. Thank you.
Yeah. We have been busy. So I doubt I'm gonna be able to be on this final budget meeting today, so.
Hmm.
I'm hoping there's no surprises.
No, it's pretty much said, we got the preliminary in, and there was no, you would have heard by now if we
Yeah.
needed to adjust your budget, so you should be good to go.
Well, and Ginger's, I have worked quite a bit on stuff this year, so.
Yep. You know, Ginger did a good
I
job.
think we're in a pretty good spot to move forward, so.
Good.
The only thing I'm concerned about is we're hearing from the state and federal level that FEP is gonna be cut 30% starting next year, which is gonna impact. I mean, Jesse's my only employee paid fully out of a grant. The state partners are talking about how they can, you know, they had a position they didn't fill, hoping to be able to continue to give the full amount of that grant to the counties, but so next year we may be in a different situation with what we're looking at that way, but.
Sounds good. I think we need to start talking about and thinking about our office situation, whether the building 5 out there is really gonna be feasible. I think we should probably maybe have a meeting with,
Well, I really do
Yeah.
think we need to look at what we're gonna do, with Molly assisting Matt. It's becoming a little more complicated. It would be really nice if Matt was in with us.
right,
She's taking a lot of calls for him, doing some work. In fact, I'm gonna go see Matt. He wants some file cabinets in our office that she can easily access, so. You know, we're just tight on space everywhere, so.
yeah, so we had a conversation, but the river building is just one big open floor plan, is that something that we can use? I mean, it's well within our budget. We just wouldn't have walls unless we wanted to start building walls. I mean, is that a possibility, or do we want to start looking at modulars again? But first, we should talk to Leah and make sure we're not spending the money out from under her that she has committed for grant applications and stuff, so. I mean,
Well,
if
I
Leah
think-
thinks we're kind of hitting a wall right now with being able to do a project out there, I think we should probably divert to something else.
Well, I think it would be good if we all sat down together and met to talk about what to do going forward. So, yeah, I'm open to that.
Okay.
Like I said,
I'm
the
just a little
next-
weary about the money that we've had sitting there for quite some
I
time.
know.
When's that gonna disappear? And then
I
we're
know.
really gonna be in a pickle where we're not gonna be
Yeah.
able to do anything for you, so.
Yeah, I mean, it's my understanding from Leah that some of that money is match money to get what she's trying to get. So I don't understand all of that totally, other than what I've heard her talk about.
Yeah.
So I think it would be important for all of us to sit down together and figure out where to go forward.
Maybe I'll get a hold of Leah and see when she has an extra minute, like a Tuesday morning, good for you typically, to come in.
We have our staff meeting Tuesday mornings, and then I meet with you guys once a month, but I,
What time are you usually done with your staff meeting?
yeah, usually by 9:30.
Okay, so if we got you in about the same time, 11
Yeah.
o'clock, I we could maybe have a quick meeting about that so we can figure out direction. If Lee is fairly confident it may happen, I'm okay with that, but if we're just kind of up against the wall and just waiting for things to come forward, then I think we need to act somehow.
Yeah. You know, the Bell House behind us is going up for sale, and there's the empty lot by it, which I think Brad and Terry Smith own.
Okay,
You know, that's another property
Possibility.
that might, I mean, would be a great location and that we're near to where we've been. We're not on Main Street, which if that's the city's concern that they're wanting Main Street property for business, that's not taking away from them. So that might be something to look at and think about. I know, Pat Lewis told me that she owns the lot by the laundromat, and that would be something that she would be willing to negotiate a very fair price on. So, I mean, maybe we haven't looked at a whole lot of other options other than the river and Cottage 5.
right,
Mostly because I'm attached to Cottage 5.
right.
But if we're looking at other things, I think maybe we, look at other things.
Yeah, absolutely. Okay, sounds good. Well, I'll maybe get an email change between maybe you and, me and Leah, just to pick a good Tuesday morning to come in and talk with the commissioners and get an
Yeah.
update on it and see if we wanna pivot now or keep pushing forward. But I don't wanna.
All right.
you know,
Yeah, that would be great. Tuesday, the 23rd, I think. I'll be out. I'll be in Billings
We'll be gone too.
at Summer
April
Institute,
That week, yeah.
but the rest of those Tuesdays I should be here. Like I said, Wednesday and Thursday this week, and next week I'll be out of town, but the Tuesdays I should be here.
Okay,
Sounds great.
All right,
thank you very much.
thank you.
Keep up the good work.